Hello to everyone listening, my name is Brenton, and our poster and presentation today is on involuntary treatment orders. As several group members did not have access to a web camera, to maintain consistency we have kept the focus of this video on the poster rather than ourselves, and have endeavoured to use the pointer to emphasise sections as we go along. I would like to hand you over to Sarah, who will begin our presentation.
In Australia, 20% of adults are affected by some form of mental disorder every year. And while most people with a mental illness are able to make decisions about their treatment, there are times when a person is unable to make these decisions due to the debilitating nature of their illness, resulting in their inability to provide consent and an involuntary treatment order being administered. The Mental Health Act 2000 provides a legislative framework for the involuntary assessment, treatment and protection of people with a mental illness under both civil and forensic systems, while safeguarding their rights and freedoms and balancing these with the rights of others. We found this topic particularly current and highly significant when investigating access to justice, considering that every day 24,000 people are being treated for mental illness at public mental health services, and of those, 1 in every 5 patients are being treated involuntarily. According to the 2013-2014 Director of Mental Health Annual Report, last year 8,146 assessments on suspected patients were conducted, of which 62% resulted in an involuntary treatment order, or ITO, being issued. That means that between July 2013 and June 2014, 6,601 people were put on an ITO. That accounts for a huge number of people who have been disabled in some form by their treatment order and who may not be able to get access to justice. Tess will now explain the nature of an involuntary treatment order in more detail.
Thanks, Sarah. So as Sarah mentioned, there may be circumstances where an individual is unable to make healthcare decisions. An involuntary treatment order, ITO, is an order permitting treatment for mental illness without consent. It is made when a doctor's assessment concludes that the treatment criteria in Section 14, subsection 1 of the Mental Health Act 2000, Queensland, is met. The treatment criteria is included on the poster as it is the access point to ITOs. During this research project, I came across a number of interesting findings that were important to me. For example, cases where applicants were appealing ITOs as the medication affected their day-to-day living, or, in some circumstances, electroconvulsive therapy which affected their memory. By reading through people's experiences, I came to the realization that these are real people trying to live a fulfilling life just like us. I realized the importance of quality of life and the effects of an ITO which can extend to family, friends, the community, and the healthcare system. The right to freedom of movement, liberty, and consent is affected. This topic was chosen as access to justice is important. Individuals should have the right to participate in and, when necessary, challenge treatment decisions. Jackie will now expand on those rights.
Thanks very much, Tess. I'll be going over this section on patients' rights. When under an ITO, patients have the right to a treatment plan and to access their treatment plan as prepared by their doctor. The treatment plan must outline the method, frequency, and time frame for their treatment. The plan should also include the location of treatment and the practitioner who's performing the treatment. The specific treatment plan should be explained as plainly to the patient as possible, as well as the reasons for the order that has been put on them. If the order was made by a doctor who is not a psychiatrist, was made via audio-visual link, then that patient may have a right to a second examination. During treatment, patients have the right to be treated according to their prescribed treatment plan, to be assessed by an authorised psychiatrist, and to have their ITO reviewed by the tribunal within 6 weeks of the order, and then every 6 months thereafter. If the patient does not agree with their assessment, they may apply for a review of the order to be done by the Mental Health Tribunal or by an authorised doctor. Given that there are no repercussions if these rights are denied, we thought it was important to highlight them on the poster to hopefully give some guidance to anyone currently under an ITO or who knows someone who is. We tried to keep it as brief and as simple as possible so as to inform our audience without boring or confusing them. It was concerning to us that an ITO could be suggested by a doctor for an indefinite period after an initial consultation, and that a person might have to wait up to 6 weeks for their ITO to be reviewed. QPIL has made a recommendation following a review of the Act to give authorised doctors the right to put an ITO in place for a maximum of 28 days, with the tribunal then being given ultimate authority to put it in place, an indefinite ITO. Thanks. I'll now pass you on to Courtney, who will talk to you about who can help.
Thanks, Jackie. What is the Mental Health Review Tribunal and how can they help? The Mental Health Review Tribunal, or MHRT, is an independent specialist review body established under the Mental Health Act 2000. The MHRT has a number of functions, but the majority of the MHRT hearings are ITO reviews. An ITO review hearing ensures that a person on an ITO meets the treatment criteria. If a person does not meet the criteria, the ITO cannot be confirmed. A significant finding of our research is that the vast majority of ITOs which get to the stage of being reviewed by the MHRT are confirmed, with only 2.8% resulting in a revocation. What is interesting is that in the annual report of the MHRT, it is noted that roughly 30% of ITOs are revoked by the medical team just prior to an MHRT hearing. The annual report also suggests that upcoming MHRT hearings trigger a more extensive review of each person's ITO just prior to the hearing, which also helps to ensure that a person on an ITO is being reviewed regularly to ensure that an ITO is necessary even before a hearing takes place. The MHRT hearing can also be a therapeutic opportunity for a person on an ITO to voice their opinions and to be listened to by the MHRT. As David Wexler and Bruce Winnick suggested in their groundbreaking work on therapeutic jurisprudence, mental health is one of the areas most suited to an approach which takes into account how the law and legal processes affect the well-being of someone interacting with the law. I'll now pass you over to Alan. Thank you.
Thanks, Courtney. My name is Alan and I'll be talking about the help available from QPILCH. The Queensland Public Interest Law Clearinghouse, or QPILCH, is a not-for-profit community-based legal organisation. The aim of QPILCH is to provide and improve access to justice for those in the community who cannot afford their own representation and who do not qualify for legal aid. Specifically on the issues of ITOs, QPILCH has a service called the Mental Health Law Practice. Through this practice, people with an ITO and people assisting others with ITOs can gain a vast amount of help. This can range from the provision of one-off legal advice through to assisting people prepare for a hearing at the Mental Health Review Tribunal, through to advocating at the tribunal on behalf of the person with the ITO. This advice is mainly given by phone or email. Interestingly, unlike other services provided through QPILCH, people requiring assistance for ITOs need not fill out the application form and can qualify for help by simply phoning QPILCH on 07 3846 6317. For those requiring and qualifying for assistance, QPILCH does prioritise who they help. People who are already inpatients with ITOs are given priority over outpatients, and people with upcoming hearings are given priority over people whose hearing date has not yet been set. Generally speaking, a 7-day notice period is required. Unfortunately, the QPILCH service is not available to everyone. QPILCH cannot help police or ambulance officers, nurses or community officers who are seeking advice on how to make an emergency examination order, or for any other mental health issue arising out of their employment. QPILCH can also not provide information to family and friends of people with ITOs who have the capacity to contact the service for themselves. Lastly, people on forensic orders or with restrictive practice issue cannot be helped by QPILCH. I'll now hand you over to Brenton, who will conclude the presentation.
Thanks, Alan. We thought the topic of involuntary treatment orders was important, as mental health disorders are a problem for a large number of people in the community. A 2007 Mental Health and Wellbeing survey from the Australian Bureau of Statistics showed 1 in 5 Australians will experience mental illness in any year. And the National Mental Health Report of 2010 notes that 65% of people with a mental illness do not access any treatment. So the next time you hear about an involuntary treatment order, it could be concerning you or someone you care about. We hope this poster and presentation have raised awareness about involuntary treatment orders. We also hope this poster can be used to help those affected by involuntary treatment orders understand the process better and know where to gain help. I'd like to take this opportunity to thank all of our group members for their hard work, and thank you all for listening.